have a frozen shoulder. We see if we can have it released. The problem is actually over there and over there. So we're going to lose it, not go to the problem area, but go to the loosening it up before going there.
I think everybody are quite curious about this new way of treating. That's the key for their success.
There is a space for a new standard in well-being.
I couldn't lift my shoulder or my arm up in a certain way. It's a miracle.
I feel alive when I'm in this town.
I think this is the first device that's actually specialized on treating fascia.
To understand fascia is basically to understand the body as a whole, and we have been separating the body for a very long time, but looking at it as a whole, we can really look at symptoms and problems in a different way.
Try not to hold me down.
When you realize that there is a new tissue or that an old tissue has new functions and you have tools to measure it and that people are collaborating a lot and you get new discoveries every month.
The way of thinking our anatomy and body, of course, is changing.
So fascia is, let's say, almost 1/3 of our biomechanics.
In your first year of medical school, you get a cadaver and they cut it up, and you have to scrupulously tag everything as you're studying the body. The fascia you can throw in the garbage can. So it's almost like we're trained to not pay attention to it.
Historically, I'm a pathologist, so I sit looking at human tissues under the microscope all day long. That's not the same as looking at living tissue, though we pretend it is. But now we have a scope that looks at the living tissue, and it doesn't look like what we thought.
Now we have all the research we need to back up all the success we have, and you get tremendous results really quick.
When you're working with fascia as an osteopath, you usually work with your hands, and with a machine doesn't require so much effort to work with it. You just let the machine do the job. But it's still important to have the skill.
I work a lot with athletes, and I use it all the time, mostly because of the vibration, and it's so hard to make the vibration by using only your hands, and you get deeper without causing pain. That's something you cannot do with other machines.
What strikes me is that we get results on other parts. We have the stomach problems, we're working with the autonomic nervous system, and it really affects the whole body.
I had a little bit pain in my shoulder, and after just a short treatment I felt really well.
With enormous interest in fascia that is coming now in recent years, I think it could be a success. It's amazing for a small company as Atlasbalans to have 2 prizes for both our products.
We've been fortunate to receive over 60 international design prizes over the years. This prize ranks among the highest, and it's also interesting that we actually got it for 2 products at the same year.
This could be the new standard of fascial therapy because it's new. Fresh, never been done before, and it's working in specific frequencies that's related to the fascia. I would say try the machine and see what result you get.